The Ministry of Health has been called upon to ensure that its field workers received their annual checkups and tests. The call has come from President of the National Labour Congress, Noel Jackson, as he addressed the recently held Occupational Safety and Health Forum. Jackson said these workers, namely the vector control workers who deal with chemicals, should be checked out frequently. He noted that the National Labour Congress has a collective agreement with the ministry that makes provision for annual checks and tests for employees. However, he stated that it is frustrating for the NLC to be constantly calling for these health workers to do their routine checkups and tests.
The test is another question because they do the checkup, but not the test, which is important. And we'd call and we'd call and we'd ask. And the only thing is left for us to do is to get a baseball bat and go down after somebody. Because in truth and in fact, it is important that you protect the workers who are exposed to chemicals. Because on that program, one sister died from cancer. We don't know that it's not from the chemicals that she has been exposed to for years. We don't know that. We don't know that at all. Because we don't have a specialist in the country specializing in occupational diseases and so on and so forth. We have, on this forum, we have also asked that some consideration be given to seeking out a scholarship for a Vincentian who would specialize in this field. Not that they would come back and go into the private sector because they would starve, but that government would employ them so that they would have a steady income and would have that expertise at our disposal.
Jackson noted that the world is becoming more dangerous as it relates to chemical use, and therefore the issue of workers getting their regular checkups and tests done has to be taken seriously.
The same area where the workers meet every morning to prepare themselves to go out to work, where the secretary or the clerk is stationed and the supervisor also is stationed on a daily basis. The chemicals are stored right there. So obviously there's an inhalation every day. And we've been asking for years, separate the building. Put a small building somewhere where you can put the chemicals so that the workers do not complain about the constant smell. In fact, some workers say when they get up in the morning, sometimes their pillow is smelled of malathion.